working as a cataract, classic and cornea surgeon at Dr. Agarwals Eye Hospital in Tirupati. So today I am going to tell about presbyopic lens exchange, which is called as PRELEX surgery. So in the current scenario, once we wake up in the morning, our life starts at intermediate vision, which is like 45 centimeters, where we see more of phones and tablets. That is where we keep here and we see. So that has become very important. Once a patient crosses 40 years of age, he loses the capacity to focus on the things that are near, which we call it as presbyopia. So he has to wear the plus power glasses, reading glasses to see things clearly. So those kind of people who are more dependent on the systems or tablets or phones, they have to wear glasses and keep it in the pocket again and again. So for these patients to get rid of glasses, to see things clearly which are far away, intermediate and near, there is an option called as presbyopic lens exchange. This is also called as PRELEX. So this procedure is dependent on trifocal lenses. Trifocal lenses are basically which one available are the panoptics and synergy lenses. So the trifocal lenses that are presently available are panoptics lenses and synergy lenses. So these are very high-end lenses where once implanted in the eye, the patient can see all three ranges of vision, which is far, intermediate and near. So he is totally independent of the glasses and he can carry out his day-to-day life without glasses. And the best part of this procedure is it's a once in a lifetime procedure. The corrected power remains same for rest of your life. So rest of the life you need not wear any glasses and will be more confident and independent of the glasses. And it is done regularly like any other cataract procedure, where in older people the lens, the crystal clear lens, turns yellowish, so they have to get the cataract surgery done to see things clearly. And in presbyopic lens exchange, we are doing it outside, in front. Instead of waiting till the cataract turns yellow, we remove the normal crystal lens and replace this trifocal lens. So the patient gets the better vision for at least for next to 40 to 50 years, which is a big advantage to the patient. Coming to the procedure of the PRELEX, the patient, it's a daycare procedure, there is no need of admission of the patient. He can come in the morning, get the procedure done, we can leave him in the evening. And it's a painless procedure, there is no need of injection or patch or anything. And patient can recover in 3 days and can resume all his activities. Patient comes in the morning, we do the surgery, there is no injection, we just put topical drops and patient doesn't have any pain. We do the surgery, then we'll ask him to wait for 2 hours, then we'll check the patient again, and then he can go back to the home.